Hi, my name is Alexia. I'm with the Animal Medical Center of Seattle Dermatology Department, and today I'm going to be talking about how to safely clean your pet's ears, in addition to how to administer ear medications. And we'll go over how to do it if you have someone to help you at home or if you're by yourself. We know that all pets are different and some are a little bit easier to manage than others, so the goal is to just try your best and see if you can utilize these tips to accomplish ear medications on your own at home. So this is Izzy here, and we're going to go over how to do ear cleaning. She's not on an ear cleaner, so for the sake of this, we're using some sterile water here. But when you have an ear cleaner in a bottle, and you do ear cleanings, and you're by yourself, so you want to kind of, if you can get them up on a table, if they're small enough, do so. If it's a big dog, we'll go over that in a minute. But if it's a small dog and you're by yourself, so you want to just pick one ear first, and you want to kind of hold their head, I tell people, like kind of like a sandwich. And then you want to flap that ear back, and then you can use your thumb to kind of hold it open so you can see the opening of the ear. And ideally you want their head pointing down, but sometimes they don't like that, so do your best. You always want to make sure not to touch the tip of the cleaner to the ear, because if the ear happens to have an infection, then you've contaminated your cleaner tip. If you touch it by accident, go ahead and clean the tip with some household isopropyl alcohol to disinfect it before you use on the other ear or on any other pets. So what you'll do with a cleaner is you will fill the canal with the cleaner until you start to see the fluid. And then afterwards you'll want to, some may drip out just like that happened, but you'll want to do a little squish at the base of the ear so that way it can coat the full canal. After that, she can shake her head and get the excess out. That's perfectly okay. And then you'll repeat on the other side. If you're right or left-handed, it may be a little more difficult, but you just do your best to kind of hold that ear pinna back. Once again, fill the canal, and then you do a little squish squish, and then you can let her shake it off. Perfect. If you're applying ear medications, you can use the same strategy, but sometimes ear medications will come home with a syringe to do a specific volume. So I like to go over that as well. Ear medicating with a syringe, if the syringe is fortunate enough to adapt with the bottle, it's pretty easy to pull up, but on occasion we have syringes that don't adapt to a bottle, like this one here. So I tell people, if you're in a situation like this, utilize the cap. Fill up the cap with some of the medication, and then you can slurp it out of the cap with the syringe. And oftentimes when we go home with syringes for ear medications, I'll give you two, one for each ear. Same reason as we don't cross-contaminate the tip is we want one syringe per ear so we don't spread infection if one ear has something that the other doesn't. When applying ear medications with a syringe, I tell people angle towards the nose because that's the direction the canal goes, but you never want to stick the syringe tip in the ear too far, because if our ears are itchy and that syringe is too far, they may do a little buck around, and you don't want to cause any trauma to the eardrum by doing that. So I'd say just go right to the opening, administer your medication. Once again, you do your little squish, and then after that they can shake their head. And then if you repeat on the other side, it'll be the same thing. Make sure you switch your syringe to the syringe for that ear. Same concept, fill it up, put it in, see how the syringe isn't too far down the canal, and then again with the squish. Like I said, if you have helping hands at home, it's always helpful to have somebody hold the pet for you. If you're by yourself, you can kind of utilize this technique. If you have a larger dog, we'll go over that next. We're here for round 2 of how to apply, or how to do ear cleaning and safely apply ear medications in your pet at home. This is tailored more to larger dogs, or if you're not able to utilize a table and you're just kind of stuck on the floor, I'll show you methods both if you have assistance or if you're on your own is mostly what I'm going to focus on, since that's what most people's situations are. Anyway, so for ear cleaning, today for today's demonstration, we're going to be using sterile water just for the sake of the demo here. This is silver. So for ear cleaning, just like we did with Izzy, you want to try to get a good grip on their head however you can, and it also depends on the ear size too. As you can see, Silver has smaller ears here, so you want to kind of adapt your grip to get a good hold on his ear pinna so you can see the opening before you start. So now that I can see his opening, I can get my stuff ready and we can fill the canal with the cleaner. And see, he's kind of moving, so I'm kind of having to adapt and move with him, and he may shake just like that at home, and you may have a little bit of trouble. Just try again and fill that canal, get him steady. I know, we want to shake, I want to shake. Very good. And then we do a squish squish at the base. And even if it doesn't go perfectly, just like that, it's as long as you get the cleaner in and are able to do this, massaging at the base of the canal, that should be sufficient. If your pet has really dirty ears and you need more than just the regular cleaning, you may want to do a little bit of a wipe out with gauze to kind of get any extra discharge that you see. But otherwise, if there's not a lot of ear discharge, the ear cleaner and the squish should be sufficient. And then you repeat on the other side. And when you have a larger dog like this too, you can definitely utilize your body. If you need to stand up or kneel, put them between your legs, do what works best. Not all pets cooperate easily, dogs and cats alike. So then you'll go for the other ear here. We fill the canal. He's not gonna love it because it's gonna feel like water in his ear. And then we'll do a little squish again. And that's all there. And see how I kind of had to adapt and stand up and kind of put him between my legs? You do what you got to do, and it's never going to, be perfect. But as long as you're able to get the task done, do what works for you. If we're doing your medications with a syringe, same concept. We want to use whatever prescribed medication by your veterinarian. If you're fortunate enough to have a syringe that adapts with your bottle, that's fantastic. If not, reminder to utilize the cap. Take the cap off of the bottle and fill the cap with your medication, and then you can slurp it up with the syringe like this and pull it up. I say if you have a dog that's more wiggly, I would get all this prepared and ready before you get your pet ready to do any of this and have everything ready to roll. You'll have 2 separate syringes, 1 per ear, so that way we can minimize cross-contamination and spreading of infection if one ear has an organism, the other doesn't. So you have your medications drawn up. Always angle the syringe towards the nose because that's the direction the canal goes. Administer, and see how I'm not sticking the syringe too far into the ear. You don't want to stick the syringe too far down because when we have itchy ears, they tend to buck around, and we don't want to risk causing any eardrum trauma from them doing so. So, just so. And then you switch your syringe, and you'll repeat with the other ear. Good boy, Silver. And we do a massage. And that's pretty much it. And I like to just throw in a reminder, using Q-tips is not typically advised for ear cleaning. If your veterinarian has specifically advised you to do so, then follow their instructions. Otherwise, if not advised, I would say avoid using a Q-tip for similar reasons. You don't want your pet to do any bucking around while you have a small object in the ear that could potentially cause trauma to the eardrum. I hope this was a helpful video for everybody.